Hi, I'm Dr. Josephitis, and I'm going to be talking about what the post-operative period after FUT strip is all about. A lot of patients have questions about how soon they can get back into their social life, also how soon they can get back into work, and I'll go over a few of these with you today. First of all, visibility. What's it going to look like after your strip procedure? Well, the good news is, in the donor area, the hair is still somewhat longer, and it'll cover the strip incision and sutures perfectly. You won't be able to see any of the surgery from the back. Now, as far as the top goes, it really depends on how much work you've had and also how much hair you had to start with. Some patients that have had just a little bit of work done in the corners, maybe a hairline, if you have enough hair behind, you can easily cover that up. It's very easy to do that. Now, if you have had more hair loss, but you have somewhat of a comb over going on that you had prior to surgery, that's actually great because we could keep that hair long and hide most of the work that was done. So that actually works to your advantage as well. Now, the tougher patients are the ones that have really not much hair to begin with, or a lot of hair loss in the front. Those patients, really, you can't do much to hide the surgery that was done on top. Well, with that, we recommend a hat. Very simple baseball cap with the adjustable straps is very important. We want to make sure it's not a tight fit hat. We want something that's going to protect the grafts and protect the scalp like this, but actually not touch the grafted area. We just want to be protecting the grafted area. So a baseball cap is an excellent idea for that. And actually for the other patients I mentioned to you, where you don't need a hat, we actually encourage a hat when you're outside, out and about. It actually protects your grafts from the elements, from the wind and from the sun, and also from onlookers, depending on how much is showing and how much surgery is actually visible. It actually protects you and makes you feel more comfortable. So a hat's a great idea, especially the first couple weeks. Now, a few weeks to a few months after surgery, you'll pretty much be looking back to normal. I tell most of my patients that at a month, you're going to look pretty much the same as you did prior to coming into surgery. So all the grafts will have fallen out by then. They don't really resume growth for about 3 to 4 months. So at a month, you look pretty much the same. Now, between the day of surgery and a month, it really depends on how quickly you heal, how soon the grafts fall, and how quickly the redness fades. But for most part, around 2 to 4 weeks, you're really getting back into a normal state of affairs. And how about the pain? How painful will this procedure be after surgery? Well, as you know, after surgery, your scalp's still going to be numb. It'll probably be numb even into the evening. Now, the pain, if you have any, will occur probably towards the evening to the next day. And the pain is usually only in the back of the scalp, in the donor area where the grafts are taken from. The top usually is not that painful. And actually, to be honest, the pain in the back is usually not so severe for most patients. I would say that for a lot of patients, it's more like a mild tension headache, an aching or soreness. Now that is only if you don't take medications. We recommend, especially the first few days to a week after the FUT procedure, to take over-the-counter medications such as ibuprofen or acetaminophen. These are really great to kind of give you a baseline pain control. We recommend you taking these around the clock for the first few days, and they should really do a great job at just relaxing the area. Now, if you're at home and you've taken the over-the-counter pain meds and you're still feeling a little sore, a little achy, especially in the evening, you might want to go ahead and take the narcotic that we provide you with. This does a great job of decreasing the pain for you. Also, as you lay down at bedtime is a really big time when you might have some discomfort in the back. And this is also a good time to take this. Now remember, you don't want to take this if you're going to be driving, drinking alcohol, operating heavy machinery, those types of things. So you want to make sure that this is only for use at home. So activity level, what kinds of things can you do right after surgery, and when can you get right back into the swing of things? Well, right after surgery, the first week especially, we want to make sure that you take very, very good care of your scalp, take good care of your grafted area. We don't want you to do anything too strenuous. We'd rather you just do kind of basic things. You can go back to work if you want, if you're able to, but really no strenuous working out, running, jogging, those types of things for the first week. The reason we don't want you to be doing those things is that, first of all, you might raise your blood pressure when you're doing strenuous activity. The raised blood pressure could, on occasion, dislodge some of the grafts. The other thing is you tend to sweat more. There could be more perspiration, and that could cause the area to be not as clean. Finally, if you're in and amongst workout equipment, things like that, you could bump the grafts out, and that's the last thing we want to do, especially in the very beginning. So the first 7 days, pretty much normal daily life, nothing more than that. After day 7, you get back into running and jogging and aerobic activity, biking if you like. It's perfectly fine, not a problem. Especially if you're daily washing your hair and keeping the scalp clean. Now after day 14 or so, you can pretty much get back into the gym, working out, weightlifting, helping your friends move, those types of things. Another good way to trigger your mind when you get back to perfectly normal activity is once you get the sutures out on the back, which is around day 14 or so, maybe a couple days before, you can get back to normal activity. That's kind of a good benchmark for you to remember after you get those sutures out. So I hope this has helped you a little bit, and good luck to you. Thank you.